Hi, I'm Janjimal Espejo, a medical intern from Cebu Institute of Medicine. Today I'm gonna demonstrate a basic surgical skill, which is chest tube insertion. Chest tube insertion is an essential skill for hospital doctors dealing with certain pleural diseases to drain the pleural space of air, blood, chyle, pus, or other fluids. It is indicated for pneumothorax, hemothorax, pneumohemothorax, subcutaneous emphysema of the chest wall in a patient who has sustained chest wall trauma requiring ventilatory support or general anesthesia, and empyema. Materials needed: sterile gown, sterile gloves, cut-down set, French 28 chest tube, Silco suture with curved cutting needle, 10cc syringe, local anesthetic, vaselinized gauze, sterile sponges, povidone iodine antiseptic, plaster, and underwater sealed chest drainage system. Prepare the local anesthetic and make sure to observe sterility. Remove the bubbles by tapping on the syringe. If possible, have the patient assume a semi-upright position with the arm placed above the head. Look for the fourth intercostal space at the anterior axillary line, which is approximately at the level of the nipple in males. Prep the skin over a wide area of the chest wall with povidone iodine antiseptic. Make sure to include the sternum, the clavicle, the subcostal area, and the posterior axillary line. Do this in an upward concentric motion. Prep the skin 3 times. Mark the final site of incision. Go to the angle of Louis and move your fingers to the second ICS. Then trace down to the next few ribs until you locate the fourth ICS at the anterior axillary line. Drape the area with 4 towels and not with a single fenestrated sheet. Secure the towels with towel clips. At the fourth intercostal space anterior axillary line, infiltrate the skin with a local anesthetic and block the intercostal nerve branches. Do not forget to infiltrate the pleura. Check the effect of the local anesthetic. Make a 2.5 to 3 cm long skin incision well into the subcutaneous tissue. The insertion site of the chest tube must be as close as possible at the upper border of the rib. Insert a curved Kelly clamp and separate the tissues so as to create a tunnel or track in the direction in which the tube is to be inserted. These tracks should be directed posteriorly, cephalad, and medially so that the tube lies posteriorly in the paravertebral gutter. Continue developing this track all the way into the pleura. Remove the clamp and explore the track with a gloved finger from time to time to make sure the track is going in the right direction. After the pleural cavity has been entered, insert the gloved finger to explore for adherent lung and then further enlarge the opening in the pleura by inserting a large Kelly clamp and by spreading it. Select the tube to be used and note the location of the holes and the distance of the proximal hole to the tip of the catheter. Make sure to clamp the distal end of the tube to avoid making a mess, especially in cases of hemothorax. Grasp the tip of the tube with a long Kelly clamp so that the long axis of the clamp is almost parallel to the long axis of the tube. Insert the tube into the chest using the large Kelly clamp as a guide. Measure the distance that you want the tube to extend into the chest and note the point of emergence of the tube. Remove the clamp as soon as the tube reaches the desired position in the chest. Palpate to ensure that the tube has entered the chest. Suture the tube to the skin with silk O using a horizontal mattress technique. Cut the needle before knot tying for safety. Tie the suture in place tight to the skin by doing a square knot. Now, wrap the ends in opposite directions around the tube to form a series of X's. Do at least 4 loops around the tube. Push the suture down before tying again to prevent slack from being incorporated into the suture. Assess the strength of the suture. Connect the tube to the underwater seal chest drainage system. Care should be taken to do this step properly, as this may cause pneumothorax if tube is disconnected from the underwater seal. Place Vaselinized gauze dressing around the tube. Next, cover the tube using 2 4x4 gauze with a slit in the center and place them 90 degrees against each other to prevent them from sliding off the tube. Plaster the dressing in place. Verify the position of the tube by obtaining a post-tube insertion chest X-ray. After completing the procedure, discard your waste and sharps properly and do hand hygiene. Thank you for watching.